I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and this is video number 4 in a series that I'm doing teaching you how to treat and get rid of your elbow pain. This exercise is called loaded elbow extension with lateral overpressure. I know, another great sexy name, but it's a very, very good exercise if the previous exercises either weren't working for you or you plateaued with them. Loaded elbow extension with lateral overpressure. This is my right arm. We're going to say that I have pain in this right elbow. This is very similar to an exercise I've already shown you how to do called loaded elbow extension. So the only difference is we're going to be adding that lateral overpressure. So in review with loaded elbow extension, when you're setting up here, you're going to be palm down on the table. Fingers are pointed in the direction of your stomach and your fingertips are off the edge of the table there. And you're just doing this elbow extension motion, just like that. Well, maybe that worked for a little while and then it stopped, or maybe it didn't work at all. Maybe it even made you a little worse. Well, let's try to add a little lateral component to this. So we're going to be pushing from the inside of the elbow toward the outside of the elbow. Okay? You take your hand is palm down on the table, fingers are pointed toward the direction of your stomach, and my fingertips are off the edge of the table. This is extension, when you just straighten the elbow that way. But what we're going to do is apply a lateral force. So I'm pushing from the inside of the elbow toward the outside of the elbow. Our hand placement, we take the web space of our other hand. My painful side is this one. Hands placed on the table. And this is the medial epicondyle. It's that point of the elbow right on the inside here. We're going just below that, just a little bit. So medial epicondyles there, go just below there slightly, and just below that point there, just below there. Hands on the surface of the table, fingers are off. I'm extending the elbow just like that, and as I'm doing that, I'm adding this lateral force. And I apply a lateral force, so I'm pushing toward the outside, and then I extend the elbow, hold 1 or 2 seconds, and then back off. Lateral force, hold 1 or 2 seconds, and then back off. Lateral force, hold 1 or 2 seconds, and then back off. So push laterally, extend, back off. Push laterally, extend, back off. Push toward the outside, extend, hold 1 or 2 seconds, back off. Lateral force, hold 1 or 2 seconds, and back off. Lateral force, hold 1 or 2 seconds, and back off. You're going to do this 10 or 15 times, 10 to 15 times, sometimes more. I've seen people need to do at least 30 before they start to see a difference. But keep doing it this way. Lateral force, extend the elbow, hold 1 or 2 seconds, and then back off. Pushing laterally, extend the elbow, back off. Pushing laterally, extend the elbow, back off. Push laterally, extend the elbow, back off. That's it. The dosing for this exercise is 10 to 15 repetitions every 2 to 3 hours or is needed for pain. And do that consistently for a couple of days. And you should know even after the first day whether or not it's working. So if you do it at that dosing and it's working, keep going. And within a matter of a week, you should be feeling tremendously better. You'll get to the point where you're maybe only doing this exercise a couple times a day to once a week. If you like what you've seen in this video, make sure to subscribe to our YouTube channel and then click on the little bell. That way you're going to be notified every time we upload a new video showing you how to do one of these exercises for getting rid of your pain. Like the video, share the video with your friends, and leave comments below. Let us know if this worked for you and how. If it worked for you, let us know. We love to hear that, and so do our viewers. And if it didn't work for you, let us know that as well, because then I can suggest a modification to the exercise, which might make it of more benefit to you, or I can steer you toward another exercise altogether, which might be more appropriate for you.